Heart disease is the #1 killer of women in the United States, and unfortunately very few women are aware of that, and even if they are aware of it, they're not really paying attention to the risk factors or communicating with their physicians symptoms that they may be having. The symptoms can be subtle in women, and they can be things that we have every day. I'm reminded of one time I was giving a lecture, and my mother actually happened to be in the audience, and she basically stood up at the end of the talk and raised her hand and said, well, you know, I have every one of those symptoms. I must be dying. And so it can be difficult. It's difficult to understand what is a symptom and what isn't. And what I try to explain is that if you were able to do certain activities the week before or a month ago, and you're not able to do them now, that should be a red flag. And examples of that, or if you were able to go up a flight of stairs and you were able to do that without an issue, you get to the top of the stairs and you go about your activities. But now when you get to the top of the stairs, you find yourself leaning on the banister or stopping and trying to catch your breath. That should be a red flag. That's a change. If you had been able to go out and walk the dog around the neighborhood and not stop, but basically have a healthy walk and get back to your house and you felt fine, but now you get a quarter of the way and you're having to stop, catch your breath, and then start again, that should be a red flag. If you wake up in the morning and you literally feel like you cannot get out of bed, that you need to stay there, and you've had a full night's sleep and there's nothing different in the activities you've been doing, that's extreme fatigue that's not explained. All of those types of symptoms should be significant red flags. So it's really listening to your body and recognizing a change.